had gone through 2 major back surgeries. I have a lot of bolts and screws and nuts and squirrel cages and fusions in my back. I have had a terrible time with all of the pain I experience in my everyday living. I lived on pain pills and my quality of life was awful. I wasn't the guy I wanted to be for my family, for myself, so I needed another way of life.
Greg is a prototypical guy. He hurt his back doing some heavy lifting. He ended up having a spine surgery, and he ended up having a second surgery. And when he came to me, he was very disappointed with the results of his surgery. He was almost at the end of his proverbial rope, feeling that there was nothing for him.
He said I was pretty screwed up. He said my back was quite a mess. He went back to the original x-rays and took me through this, and I went through a lot of spinal injections. He had recommended we did those, and they gave me some temporary relief, as he said they would. The pain would come back, and so we got into the next phases of doing the spinal cord stimulator.
That is an electrical device that is implanted in the spinal canal next to the nerve roots that are causing their pain. It produces a sensation of pressure or tingling in the areas that they typically have pain. The brain actually pays attention to that pressure, that tingling sensation, more than it does the pain. So they actually don't feel as much pain, or sometimes no pain at all, from those typical areas.
I take and I turn it up, I put it on, and I turn up the volume, and I sit for 5 minutes or 10 minutes. That's better than taking the pain pill because I can manage my pain much better. I really do have pain freedom when it comes to working with the operations. And I'm very, very pleased with where I'm headed.